everyone. My name is Basmah. I'm a patient advocate living with Crohn's disease. I'm of Egyptian origin based in Minnesota. Welcome back to season 2 of our Gastro Gyan series. This is our Ask the Expert series where patients ask clinicians questions and bust myths together about GI conditions so that we can live our best lives. Today's video is on how to navigate depression and anxiety in GI conditions. The challenges, stress, and stigma that come with GI conditions can greatly impact mental health. Furthermore, cultural stigmas can lead to shame over mental health struggles and discourage many folks from different ethnic communities from seeking help. We're so thrilled to have Dr. Megan Riehl with us today to talk about these challenges and how to navigate them. Dr. Riehl, please introduce yourself.
Hi, I'm thrilled to be here. Thank you for having me. I'm Dr. Megan Riehl. I'm a GI psychologist at the University of Michigan, where we have a fully integrated GI behavioral health program. And I work, really extensively with patients living with inflammatory bowel disease, as well as irritable bowel syndrome, IBS, and many other GI conditions. So I'm thrilled to talk about this really important topic that I always say emotional health is just as important as physical health. And we're going to discuss that today.
Thank you so much. Let's get on to our discussion. Anxiety and depression are more than just occasional feelings of nervousness or sadness. What symptoms should people look out for, and how are people with IBD, IBS, and other GI conditions impacted by them?
Yeah, so this is such an important point that, all of us are going to feel sad sometimes and worry sometimes. And so we're talking more extensively about persistent patterns of anxiety and depression. And those patterns can then affect how someone thinks, how they feel, and how they function on a day-to-day basis. And then if you throw in a chronic health condition, there's other factors that can contribute as well. So some of the symptoms of anxiety can include more of an excessive worry. Anxiety is driven by things that are uncontrollable, unpredictable. It likes to just wind its way in there, and then you can experience the symptoms both physically as well as emotionally. So some of those physical sensations can be increased tension, restlessness, difficulties with your sleep. You might find yourself then also experiencing something called heightened body vigilance, or we actually have a term called GI specific anxiety, where again, kind of the focus of your thoughts are on these uncomfortable sensations in your body that can then worsen that type of anxiety. And again, we can feel those sensations very intensely in our digestive system. When we think about symptoms of depression, those can show up as a persistent kind of chronic low mood. You might experience things like you're not as interested in things that you used to find pleasurable. Also, things like fatigue can be associated both with your IBD as well as symptoms of depression, changes in appetite or weight, difficulty concentrating. And then one that we really want to be mindful of is a feeling of hopelessness, kind of pulling away or isolating. So these are symptoms that we really want you to be paying attention to and be open to talking with your doctors about noticing how they may be driven by anxiety or depression.
Thank you so much. To share some personal experience, I've been dealing with both anxiety and depression for pretty much as long as I've had Crohn's, which is about 20 years. And most of the symptoms you describe resonate with me. And that, along with having Crohn's disease, has significantly impacted my, most aspects of my life, from social relationships to employment. And now as I'm getting older, taking care of the family and managing finances, etc. So it makes it really challenging to manage both my mental and physical well-being. And that kind of leads to my next question. So we've established that there's a bi-directional relationship between anxiety, depression, and GI conditions. For instance, an IBS or IBD flare can make it more challenging to complete tasks, leading to feelings of stress and low motivation. In turn, worsening mental health can exacerbate GI symptoms. So what are some strategies that people can do to break or alleviate this cycle?
This is also a really, that bi-directional relationship is so important to highlight because our gut is sending signals up to our brain and our brain is interpreting those signals. And that can be true with this cycle of anxiety and depression and GI conditions. So to kind of just back up a smidge before I give you some strategies that are unique to somebody that's living with IBD or IBS or other GI symptoms. I want to say those symptoms are not in your head. So your brain may be contributing to some of that visceral sensitivity in the gut that can make us increasingly anxious, or we experience anticipatory worry about how those symptoms might impact you at school or work or while traveling. Those are real symptoms. But this bi-directional relationship between our symptoms is a cycle. And the important thing to know about that is that cycles can be interrupted with a full toolbox of strategies. So I want to highlight that I'll give you some tips and tricks here, but you might find it helpful to work with a psychologist to kind of really fully implement them, especially depending on kind of where you're at with your anxiety or depression, whether it be mild, moderate, or severe. One practical place that I like to start is with a cognitive skill that I like to teach people, and that's called the 3 C's, or catch it, check it, change it. And so this is where you're identifying that your thought patterns are not very helpful, and we need to disrupt that cycle. So identifying, catching the thought that might be unhelpful, checking it for accuracy, because a lot of times when we're feeling anxious or depressed, we tend to hone in on things that might not be 100% true. So catching that thought, checking it for accuracy, and then changing it into something that's more balanced, maybe a little bit more compassionate toward yourself, or something that helps to take into consideration the realities of your current situation. So again, thinking anxiety can kind of drive you into the future where, you're trying to come up with a solution to something that hasn't happened yet, or pushing you into reminding yourself of something that negatively happened in the past. So if we can calm that anxiety down, that can be helpful. A second key strategy is activity pacing. So this is just that reality that breaking tasks into more manageable pieces, prioritizing things that truly matter, and allowing yourself some space to make adjustments when you're not feeling well, whether it be physically or emotionally, can kind of help, again, manage that relationship between your physical symptoms and your emotional symptoms. A final strategy is finding some intentional ways to regulate your nervous system. And my favorite strategies that we can all keep in our back pocket is learning diaphragmatic breathing, which can activate your body's relaxation response. It can be really helpful to do before meals if you have some anxiety about eating because it might cause symptoms. It can be a really helpful technique if you're traveling and you're not really near a bathroom when you might need it for some urgency. So learning that strategy can be really helpful to give you some confidence to manage that fight, flight, or freeze response.
Thank you so much for these tips. I really appreciate it. I have tried many things of my own, and what I've learned is how important it is to start, number one, with the smallest steps possible. And that way I could find what I enjoy, what, aligns with my values and what's important to me, like you mentioned, and just kind of build it up from there. I personally like playing music, playing the drums, traveling, being around people. Also having time for myself. Can't be around people too much, but just
Yeah.
things like that, and deep breathing too as well. So, and you mentioned about meeting a psychologist. I have a wonderful therapist right now who understands what I'm going through. But one of the challenges for many patients is how, seeking care for anxiety and depression with somebody who understands GI conditions. So how do you suggest that patients navigate care?
Yeah. So it's so important to recognize that untreated anxiety and depression can lead to worsening of your ability to manage your GI symptoms and your engagement in your treatment. So establishing care with a mental health provider is so important. And it's very reasonable and appropriate to look for a mental health provider who understands the brain-gut connection and what it may be like to live with a chronic health condition. So you can ask them specifically, do you work with patients that have chronic medical conditions? And how do you integrate kind of the management of my mental and emotional health with my medical management? Do you talk with other key important team members? So you can ask questions to a provider that you may be considering working with. They don't have to understand everything about your diagnosis at day one, but if you feel like you can build a trusting, compassionate relationship with that provider to help you stabilize anxiety and depression, that's a really good point to begin with in terms of addressing your mental health care.
Thank you so much, Dr. Riehl, for all of that advice. And thank you so much for joining us today and enlightening us on this really important topic. And I also want to thank our audience for tuning in. We hope you all learned some valuable lessons about mental health and GI conditions. Please stay tuned for more Gastro Gyan videos and check out our season 1 on SAIA's YouTube channel.